Here at our office, we focus on restoring patients' function and reducing pain. One of the treatments that we use to accomplish this is called platelet-rich plasma, or PRP. Common applications that we use this for include tendon injuries such as rotator cuff injury, biceps tendon injury, tennis elbow. We also use it for a variety of ligament and muscle disorders, as well as osteoarthritis. The procedure is fairly straightforward. It involves a blood draw from the patient's arm, and then we spin the blood in a centrifuge and extract the platelets. Once we have the platelets, we then inject it back into the area of the pathology for the patient. And this process elicits an inflammatory response with an abundance of growth factors, which helps to heal the tissue. The procedure you're about to watch today involves platelet-rich plasma directed using ultrasound guidance into the proximal biceps tendon in a patient that came in with left shoulder pain. I hope you enjoy the video. I'm Dr. Berthold with Rehabilitation Physicians of Pittsburgh. I am a physical medicine and rehabilitation physician. And I'm with our patient today who's been dealing with some left shoulder pain for about 3 or 4 months. Most of the pain seems to be in the anterior aspect of the shoulder and somewhat laterally as well. We've done some examination and diagnostic imaging. This patient has been found to have biceps tendinopathy, which is pretty advanced. There's also a split tear in the proximal biceps tendon. He's a very active guy, enjoys golfing, and so the procedure you're going to see today is called platelet-rich plasma. We'll start with a blood draw from his left arm, and then we'll spin it in the centrifuge. We'll extract the platelets from the PRP mixture, and then we'll inject it back into the biceps tendon using ultrasound guidance. So we're going to do just a standard blood draw here. Feel a little pinch. And we'll end up getting about 50 milliliters of blood from the patient's arm, which we'll use to spin in the centrifuge. You doing okay? Yeah. Okay, so we're back. So we weighed the blood using the scale, and then we'll place it into the centrifuge. And we have a counterbalance tube of equal weight. This will spin for 10 minutes at 3,800 revolutions per minute. And we'll be back. So we're looking at the patient's left proximal biceps tendon, the long head. And what we see on the screen is the tendon is very thickened. It's very swollen. There's a lot of low signal called hypoechoic changes. There's also some anechoic fluid in the biceps tendon sheath. And this right here is the bicipital groove. So this is going to be our target for the platelet-rich plasma. And we'll do the procedure so that the needle comes down in an in-plane fashion into the tendon sheath to do the injection. All right, so the spin has completed. We'll take the tube out of the centrifuge, and what you'll see is a separation of the blood into different components. So up here we have the plasma layer. The middle section is where the platelets are that contain growth factors, and then the red blood cells will be the heaviest and fall to the bottom of the tube. So we'll extract this middle layer, and that's what we'll use to inject into the biceps tendon. Okay, we're ready. Maybe a little poke. Okay, you can see the needle entering the tendon there on the screen. Okay, and you're going to feel a little bit of pressure as the platelets come in, okay? There's some numbing medication in it to help with the discomfort. You can see on the screen that the platelets are filling up the biceps tendon sheath. Okay. We'll direct the needle into the tendon itself. Inject some platelets into that area. And we're just about done. So we got maybe about 2 to 3 milliliters of platelets into that tendon. Doing okay? Okay, and we're all done. Needle's coming out. All right, that's it.